Getting you prepared for your day by bringing you the latest information in the fight against the coronavirus.
And we begin this morning with the big changes over at UNC Charlotte. Here's what we know. The university announced it is pushing back the fall semester. It will now begin September 7th. That's 2 weeks later than originally scheduled. The university says pushing back this start will allow additional time between the projected peak of the virus and the start of the school year. Well, if you've been homeschooling your kids, you know just how important this is. Today is Teacher Appreciation Day. It's a perfect opportunity to say thank you to all those who do so much to educate our kids, especially in these really difficult days. We encourage you to reach out to your child's teacher today.
And Governor Roy Cooper has a busy day ahead. He will preside over the Council of State meeting this morning before holding his daily coronavirus task force briefing this evening. We are waiting to hear more from him about the timeline for when the state could enter phase 1. And Mecklenburg County leaders, they're anxiously awaiting word on those plans for phase 1.
Yeah, just yesterday, the county manager said the peak of the outbreak may not happen here until July, and that's actually pretty good news because it means we're flattening this curve. But that does not mean that we'll stay at home until then. We have Eyewitness News reporter Anthony Costura live for us in Southwest Charlotte this morning with the questions that county leaders are still working to answer. Anthony?
And John, stay-at-home restrictions could be eased by the end of this week, meaning malls and other stores could reopen. Great news there. But now we know that several businesses, including Costco, like this one behind me, require customers to wear face masks inside. And now Mecklenburg County officials are considering whether to make that a requirement. Under phase 1, the county health director believes the state will suggest people wear face coverings anytime they leave the house. If the county were to mandate face masks, the county manager says it would be stricter than the state's rules. The problem here is that face masks are not always easy to come by for customers or employees. They also don't want people to purchase N95 masks, which are so critical for healthcare workers. Representatives from Atrium and Novant Health told Channel 9 they do not believe a countywide face covering mandate is needed, but right now the county is waiting for Governor Cooper's decision on the issue before they decide. The county is also receiving feedback from local business owners to determine if this mandate is even feasible for all stores. And Governor Cooper is expected to discuss whether we are ready for phase 1 as soon as today. Brittany?
Still a lot of details to work out. Anthony Costura live for us. Thank you, Anthony. And COVID-19, it has had a detrimental impact on local budgets. We spoke to the city manager about Charlotte's budget, and Marcus Jones said that the easiest thing to do would be a 1.5-cent property tax increase. He says that there will be no tax increase in the 2021 fiscal year budget. In addition, no city employees will be furloughed or laid off, no capital projects delayed, or reductions in bond referenda amounts. Now, the city manager will close a $21.8 million gap due to COVID-19 by eliminating vacant positions and holding some jobs open, then shifting some funds and reducing expenses. Now, there's also good news for city employees, including our first responders. In addition to no layoffs, this budget includes some raises for them.
As expected, Governor Cooper signed a $1.7 billion aid package, which includes help for small businesses, minority families, and school resources. This will also pay for research. It'll pay for personal protective equipment, contact tracing, and expanded testing as well. The bills Governor Cooper signed not only allocate the money, they also amend state law, setting standards, including loosened restrictions for filing your taxes, creating a process for students who couldn't take tests like the SAT, and creating a plan for a state emergency stockpile of that protective equipment.
This emergency funding is just a first step. There will be more work ahead. We need it to repair the damage that has been done by this virus and to look ahead at how we can prevent illness in the future.
Now, the governor and state lawmakers still need to figure out just how they're going to cover the budget shortfall that's created by the emergency aid package.
The number of coronavirus cases across the Carolinas continues to grow even as we move closer to phase 1. In North Carolina, there are 11,848 cases in 99 out of the 100 counties. Avery County is the only one in our state without a case. If you take a look at South Carolina, it's reported 131 new cases yesterday and 8 more deaths. The state now has more than 6,700 cases of COVID-19. Atrium Health continues bringing its COVID-19 testing sites to some of the community's most underserved areas. Take a look. Here is where those testing sites will be set up today. The first will be located in the Greer Heights neighborhood. This is at Antioch Missionary Baptist Church. It is on Skyland Avenue. And another testing site will be set up in Concord. This one at the Daniel Farr Building on Georgia Street Southwest. Now, if you feel like you need to be tested, you can show up anytime between 10 this morning and 4 p.m. and you do not need an appointment. A new coronavirus antibody test is the first to receive a thumbs up from the federal government. The Food and Drug Administration authorized the test, which is based by New Jersey-based Euroimmune. Now, it can tell if people have been infected with the virus and recovered. Other tests are currently available, but public health officials say those are not accurate. And we told you that the need for blood is at an all-time high. The Red Cross says it is facing a severe blood shortage in response to the coronavirus pandemic. So starting tomorrow, Charlotte Motor Speedway is teaming up with the Red Cross and One Blood for a blood drive. From 10 until 3, donors give blood at the Speedway. You'll need an appointment and you will be required to wear a mask. We have posted how you can pre-register and where to go on our WSOC TV app.
And hey, we all know that nurses, they're on the front lines battling COVID-19, and now a local nurse even beat it. Alyssa Labasco spent weeks on a ventilator at CMC Maine. Yesterday, she was finally released from the hospital. This summer, she started her nursing career at Chermont Medical in Gastonia. And doctors aren't sure where she contracted that virus, but she will not forget when it started.
It started with just like 4 straight days of vomiting, and it was a nightmare.
Wow, she remembers going to ER at Atrium about a month ago now. Her symptoms became so bad, they had to move her into critical care.
It was scary. I couldn't stop crying, but I also couldn't breathe.
I'm so glad she's doing better this morning. Labasco says nurses threw her a birthday party, even though she was too sedated to even know what was happening at the time. And prayers and well wishes came in from first responders and other nurses. Well, it may be a long time, though, before she's back to work as a nurse. She's resting now in her hometown in New Jersey, and we're glad she's home this morning. Well, get this. According to the CDC, between 10 and 20% of U.S. coronavirus cases are healthcare workers. The CDC also notes that most healthcare professional patients have not had to be hospitalized, but severe outcomes, including death, have been reported in all age groups. We've seen an overwhelming demand for food at local pantries since the virus left many of our neighbors out of work, and Channel 9 viewers like you are really stepping in to help out. Staff at Second Harvest Food Bank of Metroline, they're busy right now putting together thousands of food boxes and book bags. By donating money through the 9 virtual food drive, you're helping the food bank purchase food to fill these boxes. Second Harvest expects the need to grow in the coming months. The greatest need right now is money to buy healthy, shelf-stable items for those food boxes. And because the need is so great, we're asking for your help once again through the virtual food drive. All you need to do is go to 9fooddrive.com. You'll see the website on your screen. You'll get all the details on how you can help our neighbors who are really in need this morning.
So great.